Okay, so this is your new and improved head, neck, nose, throat, and regional lymphatics lecture. So I know we kind of breezed through this really quickly on Tuesday, but I wanted to hit some more of the high points that really goes more into like your health assessment and especially what you're going to be doing in health assessment practicum. Um, I understand that you'll have a test next week, and so I'm going to try to do a review at the end of foundations as well, to hopefully help. Sorry, it shut out on me. Okay, so moving forward, maybe. Okay, so next here we have a picture of your cranial nerves. Now, this seems like a lot and overwhelming, and you do not have to locate where each cranial nerve is. But there are several assessments that we're going to talk about that are associated with the function of these cranial nerves. You don't have to know every single one of them for your test, and I'll let you know which ones you need to focus on for your test. Okay, again, this is just a list of them all and the nerve type and the function of each. So we'll go into more depth on these, but please review these and know these. You mainly need to know your olfactory, optic, your 3, 4, and 6. Make sure eyes do tricks, as Miss Ferguson says. And then you need to know your trigeminal, your facial, and then your accessory as well. And these are some cranial nerve mnemonics that are just helpful. You can choose whichever one you want just to kind of help you remember all of the cranial nerves and the order of them. Okay. Okay, so again, when we're looking at the face, of course, the biggest thing we're looking at is symmetry. Because if the face is not symmetrical, we are usually worried about a stroke or a cerebral vascular accident, which can be an emergency, of course. So we want to make sure we can recognize signs and symptoms of that. The face is innervated by the cranial nerves 5 and 7. We also have our temporal artery that's located right here on either side. And then we have salivary glands that we're kind of going to be looking at as well, and we will talk about these soon. Okay. Another great picture to help remember cranial nerves, okay? So if you're a visual person, this one is really great. So olfactory, so think of 1, you have 1 nose. Optic is 2, you have 2 eyes. So olfactory is smell, optic is seeing, oculomotor, so 3, 4, 6. Oculomotor, trochlear, and abducens, those are all involved with the movement of your eyes. So 3, 4, 6, make sure eyes do tricks. Trigeminal, that's the feeling of the face. So you can see there's a 5, so think of like drawing a 5 on your face. Because that has to do with the feeling of your face. Okay, 7 is facial, so it encapsulates your face. And then acoustic is 8, so your ears. So 8s kind of look like ears if you really think about it. And then accessory is the other one we're going to kind of focus on, and that is your shoulders. So this is tested with shrugging of the shoulders against resistance. Okay, and then these are your salivary glands. So you have your parotid gland, submandibular, and sublingual glands. Let's see. Yeah, so basically that's just kind of where your saliva comes from. Sublingual is under the tongue, and then submandibular is down by your mandible, and then parotid is back up here. Okay, so another assessment that we're going to focus on for the head and neck is our lymphatic assessment. So functions of the lymphatic system, it conserves fluid and plasma proteins. It also helps to filter and engulf pathogens, preventing re-entry into the circulatory system, and it absorbs lipids from the intestinal tract. So basically, whenever we're assessing, we're going to palpate the lymph nodes. It's just important to kind of understand what they do and why they might be enlarged or abnormal. So here is a picture of just the regional lymphatics of the head and neck. We're going to go over each one and where you're going to be palpating for them. Okay, so your pre-auricular, okay, so auricle is your ear, okay, so pre-auricular is in front, post-auricular is behind, okay, so pre-auricular, post-auricular, all right. Occipital is at the base of your skull, so behind your skull, at the very base of it is where you're going to feel for that, under your hair, you know, all that, okay. Then we have submental, which is under your chin. Submandibular, which is on the sides of your mandible here. And then you have your superficial cervical on your neck. Okay, overlies the sternocleidomastoid muscle here. Deep cervical is under the sternocleidomastoid muscle. Okay, so you're going to have to palpate a little bit deeper there. Okay. So cervical, and cervical is neck. All right, supraclavicular. So supra above, clavicular, we have our clavicles here. So what we're going to have our patients do is shrug their shoulders, and then we're going to feel right in that little kind of hollow that it creates. Okay. We also, so posterior cervical, I don't know that was on here. We are also going to feel for our posterior cervical, which is going to be further back on our neck, okay, down towards our trapezius muscle, all right. Okay, so important things when we are palpating for lymph nodes. So most of the time, lymph nodes are not going to be enlarged. We're not going to be able to feel them. Okay, that's a normal finding. When we are feeling them, we want to ask our patient if they have any tenderness. So if they are experiencing any tenderness, they need to just let us know. If we feel them, if they are enlarged, that's an abnormal finding. It could mean they have an infection. If they are fixed, like we can't move them, this is typically associated with some kind of, could be like a cancer. So that's why it's important just to note what they feel like and what we're looking for there. Okay. And then if the patient has had a history of a head injury or headaches, we want to get a good history associated with this, okay? So if they have had a head injury, we really want to know what type, so what happened, and did they have a loss of consciousness? Okay, so this is kind of differentiating between like a concussion, you know, versus like a traumatic brain injury or something more serious. What was their treatment, etc.? Do they have any lasting symptoms? So headaches, so with both of these, we want to do our OPQ-RST, okay? With headaches, a lot of times they will have like prodromal symptoms or like symptoms that happen before the full-blown like headache or whatever happens. So this is when you hear some people say they have like an aura before they have like a migraine. This could be like blind spots or like kind of like flashing lights. It can kind of look different, you know, or be different for whoever is experiencing it. But these are like symptoms that a lot of times occur before you get like a migraine. Could be nausea, things like that. Okay, if someone comes in and they have a like stiff neck or nuchal rigidity, you want to check and see if it's because of an injury or a strain or if they've had some kind of surgery in the past. What's the character of it? You know, what led to this? Have they tried treatment? Has it worked? What medications are you taking for this, if any? A lot of times with stiff neck, though, we think that it could be potentially associated with meningitis. So this is why we look to see if they've had a fever, bacterial, or a viral illness, because meningitis can lead to that nuchal rigidity, can be serious, and they would need to be seen in a hospital for this. Okay, so we discussed in class how to kind of feel for the thyroid, but we're also going to go into a little bit more or a little more in depth on what actually a thyroid problem is and some signs and symptoms of that. Okay, so you can either have hyperthyroidism or hypothyroidism. Okay, so some key things to look for is, if they have like a temperature tolerance or intolerance. This is when this is not just a preference, like I prefer it to be 70 degrees in my house or whatever. This is like they cannot tolerate the hot or the cold. They could have swelling, they could have changes in their hair, skin, or nails, changes in their emotions, changes in their face. They could have increased heart rate, changes in bowel or menstrual flow, and they may be on certain medications to help with this. Oops. Okay, so hyperthyroidism. So this is when you've got increased your thyroid is working in overdrive. So your thyroid deals a lot with metabolism of the body. So if your thyroid is working overtime, you have that increased thyroid hormone, you're going to have signs and symptoms that are typically associated with increased metabolism. Okay. So it kind of speeds everything up. So for them, a lot of times they will have intolerance to heat. So they will be hot all the time. They can have fine, straight hair. They might have that exophthalmos, which is bulging of the eyes. You can see in this picture, they may have an enlarged thyroid or goiter that we did talk about in class. Tachycardia, so things are increasing, right? So increased heart rate. They could have an increased systolic blood pressure, could have breast enlargement. They typically have weight loss and muscle wasting. They can have amenorrhea or menstrual changes, tremors, and diarrhea. Okay, so these are signs and symptoms of your hyperthyroidism. Okay, so everything's kind of increasing. All right, hypothyroidism, this is the opposite. So things are kind of decreasing, slowing down. So this is when somebody has, a lot of times I'll be really cold. So they'll have intolerance to cold. They may have a receding hairline. They may have some facial or eyelid edema. They could have like a dull blank expression, extreme fatigue because everything again is slowed down. They could have like a thick tongue that leads to like slow speech, anorexia, brittle nails and hair. They can also have menstrual disturbances, hair loss, apathy, lethargy, dry skin. It can be coarse and scaly. You see a little man here holding his body lotion. And they can have muscle aches and weakness, and then constipation. So a lot of these are kind of, opposites. So hypothyroidism, everything's kind of slowed down. They can have weight gain with this. And the late clinical manifestations, so if something's not done about this, like if they're not taking some medication, like Synthroid to help increase their thyroid hormone, late signs would be them having a decreased body temperature, bradycardia, so low heart rate, weight gain. They can have a decreased level of consciousness, thickened skin, and then also cardiac complications. Okay. And we also, of course, want to know any history of head or neck surgery. So, anything with their head, any kind of like sinus surgery, and then, of course, anything with their thyroid. Okay, so looking at our findings, we want to note the general shape and size of the head. What's their facial expression? Is it appropriate for the conversation? Are their features symmetrical? Do they smile and lift their eyebrows symmetrically? Or is there anything abnormal that you notice? Again, so symmetry, we worry about a CVA if they have any facial drooping. It could also be Bell's palsy, which is like the facial nerve paralysis. So that could happen as well, and it may not be a CVA. And we'll talk more about that too. All right. So looking at faces, so this encompasses expression or appearance of the face and features of the head. All right. So Bell's palsy. So your facial nerve. So we were talking about our cranial nerves. Your cranial nerve 7 is what this one affects. So your facial nerve. So think of the little 7s going around a person's face. Okay. This is typically after like a virus or something like that, and it affects the facial nerve. Most of the time, this is just temporary. So with Bell's palsy, they may have the drooping of the face, but they shouldn't have any other symptoms that would be associated with a stroke. So like the weakness of the limbs or anything like that. Okay, and then when we're palpating, we're going to use our fingers to palpate the scalp, the temporal arteries, and then palpate for TMJ. So that is, we do that by going right here and having the patient open and close their jaw and feeling for any like crepitus or clicking and things like that. Okay, so if we are going to test the cranial nerve 7 or the facial nerve, this is where we have them, we're looking at the motion of their face, making sure it's symmetrical. So you have them raise their eyebrows and then squeeze their eyes shut, wrinkle forehead, smiling, showing teeth, pursing lips, and puffing cheeks out. So that way we make sure they can move their face like they should. Okay. All right, and then inspecting and palpating the neck. So looking to make sure the head is midline, muscles are symmetrical, looking for any enlargement of the salivary, lymph, and thyroid glands. So that's why we kind of need to know where these things are, so we know what structures we're looking at and what could be causing the edema. Thyroid enlargement may be unilateral, meaning on one side, or it could be all the way across, and that would be like goiter, so like the enlargement of the front of the neck. Okay. We're also going to look for any like pulsations. This is usually localized just below the angle of the jaw. And then we can also test for neck range of motion. So if the patient's complaining of any neck stiffness or like previous injury to the neck, basically, I know we talked about this in class too. You're just having them do all the motions you should be able to do with your neck. So chin to chest, looking up to the sky, tilting right, left, and then have them go all around. So circumflex. So the movement should be fluid with this and no pain or crepitus like, like popping or things like that when they're doing this movement. Okay. So when we are testing for cranial nerve 11, so this is our accessory, this is basically the shrugging of our shoulders. So you want to check, have them turn their head against the examiner's hand. So if I have my hand right here on my patient and then they turn their head, they should be able to turn it against resistance. So they do that both sides, and then shrugging the shoulders against resistance. So I would put my hands on my patient's shoulders, and then they would be able to push up against the resistance. That would be a normal finding. And that's going to be your cranial nerve 11, or your accessory. Okay. And then when we are palpating lymph nodes, we're going to use circular motions and try to do the same order each time, so that way you can remember them and compare them side to side. So with this, you're using circular motions. We're doing them bilaterally, so on both sides and simultaneously. So we're comparing them at the same time on both sides. So we're going to do fill. You can fill in circular motion. Some people kind of do like this kind of motion here. That's okay. We're going to note location, size, shape, if we can feel them. And then we're going to note any consistency or tenderness or warmth. All right. And then just noting again their location and what it could be potentially associated with if they are enlarged. Typically with an acute infection, they're going to be enlarged bilaterally, so on both sides, not just unilaterally on one side. And they're usually going to be warm, tender to the touch, firm, but they will be freely movable. So this is typically associated with someone who just has some type of infection, especially if they have like a head cold or something like that. They may have some bilateral swelling, tenderness, firmness, but they should be able to be moved. If it's a chronic infection, they may be more like clumped together where you can kind of feel more of them together. If it is cancerous, so if cancer has moved to the lymph nodes in this area, they are going to be hard. It's going to be on one side. It will not be tender. And they will be fixed, so you will not be able to move them. So that's the big difference between the cancerous and then just them being enlarged from an infection. They're not tender. They're going to be fixed in one spot, so you're not going to be able to move them. And it's just going to be on one side versus both sides. If someone does have HIV, their lymph nodes can be enlarged, firm, non-tender, but they will be mobile versus immobile with cancer. And then they are commonly, these enlarged lymph nodes are going to be in the occipital region, so at the base of the skull. Supraclavicular enlargement. So when we're having our patient shrug and we're feeling right here, this may indicate a neoplasm. So a tumor, a cancerous tumor in the thorax or the abdomen. Okay. This is a picture of inspecting and palpating the trachea. So that's our windpipe that's connected to our lungs. Okay, so we're going to place our finger on our suprasternal notch. Okay, and then we're going to kind of feel on both sides. We should be able to kind of make sure that we feel that it's midline. If it's not midline, that would be abnormal. It could indicate a mass in the neck or some kind of thoracic problem. So we just want to be mindful of that. Okay, so when we are inspecting and palpating the thyroid, so it should be small, smooth, and free of nodules or masses. The right side is 25% larger than the left. We can use a light to shine tangentially, so taking a light and shining it on the neck to see if it casts a shadow, to see if it's enlarged. You can have your patient sip water. We talked about this in class, and it should move up as you swallow and move back down. You can, if it's enlarged, you can auscultate with the bell of the stethoscope to see if it has a bruit, which is a sound that is caused from turbulent blood flow. Okay. And then, so this is, we can listen to our carotid arteries. So you have your two